guest. He coordinates the intensive care response at the epicenter of the outbreak. His name is Dr. Giacomo Grasselli, and he is in Milan, Italy. Dr. Grasselli, you're on the front lines of northern Italy's coronavirus outbreak. Describe for me the situation, the emotion that it's causing as well.
Yeah, the situation is very bad here, I would say. To give you an idea of the overwhelming number of patients we are taking care of, I can tell you that we had like 800 intensive care unit beds before the crisis. We have currently being treated in the ICU almost 600 patients, plus another 100 that have been discharged or died. So we've treated a total of more than 700 patients in less than 3 weeks. So this is a tremendous effort. We have opened new beds, of course, so we've increased our ICU beds capacity of about 50%. We have completely reorganized the hospital network. We have created a network of dedicated COVID-19 ICUs where we cohort and isolate those patients. And doctors are working, doctors and nurses, of course, are working 7 days a week, 24 hours a day.
Let me ask you this, Dr. Grasselli. Is it too little too late? Was your country just behind the 8 ball here?
Can you repeat, please? Sorry?
Is it too little too late? Did your country not do enough from the beginning, do you think?
Well, I don't know. You have to think that this situation is like a bomb that explodes, and you're simply overwhelmed by an incredible number of patients. Maybe we should then enforce even more the containment measures. So the message I want to give to everyone, to every country who could hopefully not, but has the chance of facing this, is that the most important thing is to teach people how to behave in these circumstances. Because if you do not stop the spread of the disease, your health system, no matter how good, how efficient, how modern it is, sooner or later will collapse because the number of patients is too high for the resources we have everywhere in the world. So the most important thing is how the people should behave in order to stop the spread of the disease.
From a medical perspective, is locking down the country, 60 million people there in Italy, is that the way to do what you're saying?
I think so. And I would even enforce the measures. So, for example, now, let's say that bars and restaurants are still open until 6 o'clock in the evening, but they might be closed completely. And people should work from home or even stay, let's say, home and not going out, avoid any crowded place. The point, what's terrible of this disease is that you actually have to limit personal freedom and you have to limit, the interaction between human beings. But this is too important. Otherwise, this is going to be a disaster for Lombardy, a disaster for Italy, a disaster for Europe, and potentially for the entire world. So we're living this now, and my mission is not only to take care of Italian patients, but also to tell other people in the world how to get ready for this, because this is actually like a tsunami.
So,
okay, that it's coming.
If you had to say to the other European countries, this is how you get ready, what would be the top 2 things on that list?
Well, first of all, you have to teach your healthcare professionals on how to properly use the personal protective equipment, because as you know, there's a certain risk of infection among healthcare workers, and that's another big problem. Second, teach the population, have the population ready, because no one is ever ready to be locked in. So they have to know that if this is coming, and when you understand it's coming, before the bomb explodes in one small part of the country, the whole country has to react. And third thing is to try to think of an organization of the ICUs like create a network of ICUs where you can put those patients, where you can isolate those patients, and to be ready to improve your ICU capacity. Then hopefully not everyone will live what we are living here now. Even in Italy, I mean, there are several regions that have a certain number of patients, but nothing comparable to our region. I don't really know why. Probably we have a very high density of population, and people come and go from Milan a lot.
Yes.
So so that's probably one explanation, but it's very, very bad what we are experiencing here now.
I have one final question for you. When you go out into the streets, Dr. Grasselli, or you meet patients there where you are, do you think people are taking this seriously enough now?
If you asked me this question 2, 3, 4 days ago, I would have said no. From yesterday, we had a message on TV from the President of the Republic like a few days ago. Then we had a couple of messages from the Chief of the Government. And from yesterday, I think that people are actually realizing that something very dangerous is going to happen. And that how this will go very much depends on what people do, because you cannot stop this by increasing the number of ICU beds or buying new ventilators. This is important to take care of the people who already are sick. But the only way to survive is to avoid other people to get sick.
Right. I want to thank you for your time, Doctor, and I wish you the best with what you are doing there in Milan. Thank you. That's Dr. Giacomo Grasselli, coordinating the intensive care response at